Speaking this morning, we have Premier Carolyn Cochrane, Health and Social Services Minister Julie Green, CEO of the Northwest Territories Health and Social Services Authority, Kim Riles, and Chief Public Health Officer, Dr. Kandola. As per usual, following their remarks, we will open the floor to questions. I'll run through each of the media members by name one at a time. I'll give you each the opportunity to ask one question as well as one follow-up. When you ask your question, please provide the name of the person to whom you wish to direct your question if you have that person in mind. If not, I will help determine who should answer the question. With that, I'll turn it over to Premier Cochrane to deliver her remarks.
Thank you, Ali. Thank you everyone for joining us here today. Since the most recent outbreak of COVID-19 occurred, the government of the Northwest Territories has been working round the clock to do everything we can to protect residents and our communities and limiting the spread of the virus as much as possible. I commend the work of our healthcare professionals have done to manage the current outbreak, but we're not out of the clear yet. We still have work to do. We continue to see community spread in Yellowknife and surrounding areas. That's why the Chief Public Health Officer will be issuing a temporary order to limit gatherings in Yellowknife, Dettah, and Behchoko. She'll speak more to this momentarily. The Chief Public Health Officer will also recommend that businesses in Yellowknife, Dettah, and Behchoko accommodate for remote work with only essential staff and minimal occupancy in effect. The government of the Northwest Territories will be following this recommendation and sending staff to work from home wherever possible. The order and recommendation are in effect for 14 days, starting at 5 p.m. today, and there's a possibility that it can be extended. We'll continue to monitor the situation closely to make sure that we make decisions that protect residents and communities first, and our healthcare system and staff. Since the beginning of this outbreak a few weeks ago, there continues to be mounting strain on our healthcare system. This is obviously a great concern to the government of the Northwest Territories, and it's important that we do what we can to protect the integrity of the system and ensure people can continue to receive the medical attention that they need. The strain is not only on the services we provide to residents, but on the people who continue to deliver healthcare services in the N.W.T. and those supporting the pandemic response efforts. As community spread continues, it puts at risk healthcare professionals who are working to protect residents and communities. We need to do our part to ensure we have all hands on deck to continue to support our response to COVID-19. When we released Emerging Wisely 2021, we understood that there was a likelihood that we would see an increase in cases of the virus in the Northwest Territories. What Emerging Wisely allows us to do is effectively manage our risk to prevent and respond to outbreaks. As we've eased restrictions, as conditions and information has allowed us to, it also allows us to enhance restrictions where required and target restrictions as necessary. We know that this is challenging news to hear. A few weeks ago, we stood here and said we would not take a step backwards. As we've seen throughout the pandemic, though, things can change very quickly. These decisions don't come easily, but these interim measures will allow us to continue to move forward with Emerging Wisely and our reopening efforts. I've said it many times, our best defense against the virus is getting vaccinated. If you haven't done so yet, please book your appointment. On that, I'll turn it over to Minister Green to provide brief remarks. Thank you again.
Thank you, Premier, and good morning, everyone. We're approaching a pivotal moment in the territorial healthcare system's ability to respond to COVID-19 and the related community outbreaks. As things stand now, without swift and coordinated action from our public health officials, political leadership, and the public, we risk putting unnecessary pressure and burden on our healthcare system and our healthcare workers at a time when we are already facing capacity challenges. Some may ask what has changed and why we need to take this step now. The reality is that COVID-19 is an unpredictable disease with the potential to rapidly put any healthcare system under significant pressure. That is what we're seeing in the Northwest Territories right now, and we need to move just as quickly to relieve that pressure. Extraordinary efforts have been made across our healthcare system, despite staff shortages and other challenges, to successfully meet the needs of N.W.T. communities. These people are our most valuable assets in the fight against COVID-19. We owe them all a huge debt of gratitude and our support. Support means more than just saying thank you, although that's good too. Support means each of us taking practical, concrete steps in our own lives to help limit case numbers and the burden they place on the system. We can make a difference through everyday actions, and that's what we're asking people in Yellowknife, Dettah, and Behchoko to do today. While this isn't always the easy thing to do, it is the right and necessary thing to do. So what can the public do to help? First and foremost, if you are able to, get vaccinated. Vaccines limit your ability to get and spread the virus. They also drastically lower the chances you'll need medical attention if you do. Secondly, please follow the orders and recommendations from the Office of the Chief Public Health Officer. These guidelines and orders aren't put in place to restrict your freedoms. They are put in place to protect you and to protect our healthcare system's ability to treat you should you get sick. I know what we're asking of residents can be difficult, but this is what's required to defeat this virus and support those who need the help most. With that, I'll now call on Kim Riles, the Chief Executive Officer of the Northwest Territories Health and Social Services Authority, to deliver some remarks. Thank you.
Thank you, Mr. Green. I'm here today to ensure that there's public awareness of the impacts of the worsening COVID-19 situation on the N.W.T. health and social services system. Since the beginning of the pandemic, we have said that one of the primary goals of the public health measures that were put into place has been to protect the capacity of our healthcare system to care for patients, both those who need us because of COVID-19 and those who need us for every other issue. Predictably, as the public health measures have eased, we have seen a rise in the number of COVID-19 cases in the N.W.T. This was not unexpected, but it is having an impact on our health system capacity. And today I am announcing updates to our service delivery that are intended to create and ensure capacity to respond to the challenging situation that we are facing. The N.W.T. health and social services system has a pandemic plan in place that guides our planning and the actions that we take to address mounting demand for health services in the context of the COVID-19 pandemic. In light of the increased demand, NTHSSA is taking the step of implementing stage 2 of our pandemic plan. As part of stage 2, we are increasing our ICU bed capacity from 4 to 6 and will be opening 3 additional inpatient beds at Stanton. We will also be working to secure temporary long-term care placements for some of the medically discharged patients who are currently occupying inpatient beds at Stanton. In the coming days, we will be reviewing our surgical slates at Stanton and will be postponing certain elective procedures and surgeries. This will allow us to preserve space in our hospitals for patients who need higher levels of care, as well as to redeploy staff to other critical areas of need. We want to assure residents that NTHSSA will maintain urgent and emergent procedures, which includes cancer surgeries. In Yellowknife, primary care services will transition to virtual care wherever possible, and certain types of elective visits may be deferred. We have increased our capacity at the Yellowknife Testing Center to accommodate increased demand for COVID-19 testing related to school and other outbreaks. Many of our community health centers throughout the N.W.T. are operating on either reduced or emergency services due to staff shortages or to focus on outbreak management activities. We know that many N.W.T. residents are watching the COVID-19 situation in Alberta with interest. Alberta has been experiencing very high case counts of COVID-19, as well as rapidly increasing hospitalizations. As we have since the beginning of the pandemic, NTHSSA has remained in close and ongoing contact with our partners at Alberta Health Services. They have confirmed that they will continue to consider NWT residents as equivalent priority to Alberta residents and will continue to accept patient transfers. AHS has announced that they will be reducing elective procedures, and as such, some NWT residents may be advised that their planned appointments in Alberta have been either postponed or cancelled. Patients who are impacted by service reductions either here in the NWT or in Alberta can expect to be contacted by their healthcare provider. For more details on NTHSSA service levels, I encourage residents to visit the NTHSSA service level dashboard found on our website. We have also just released a media advisory with more detailed overview of specific service impacts, as well as details on how to find out more information. We ask you to continue to seek necessary care and to trust that we have put measures in place in our health and social services facilities to keep you safe. So please, come to our emergency departments if you need emergency or urgent care, and make appointments for other type of care that should not be delayed at our primary care clinics and our community health centers. Health systems are built on people. In the NWT, we have always struggled to recruit and retain qualified staff, and this has been further impacted by national shortages of healthcare workers and surging demand in provinces that have been hard hit by COVID-19. Since the spring, our public health and our testing systems have been very strained to meet the demand related to outbreak and containment measures. We are now seeing this impact and demand extend to our acute care and our community health system. Our workforce is limited and is also being impacted by isolation requirements, just as other NWT residents are, by issues such as public exposures or by being named as a contact of a positive COVID-19 case. So on behalf of NTHSSA staff, I ask you to follow the guidance being provided by the CPHO. Please do your part. Limit our risks, get your vaccine, stay home, and keep your kids home when they're sick. If you have not already been vaccinated, please consider reaching out to any of our health centers, our primary care clinics, or our public health units to learn more about the COVID-19 vaccine and to consider getting immunized. Our health system is not yet overwhelmed, but we are sitting on a critical precipice. We have reached out to all of government to appeal for support to the healthcare system and are now reaching out to residents to ask that you observe the guidance of the CPHO and of public health staff, as this is key to limiting the ongoing spread of COVID-19. In closing, I want to take the opportunity to thank the residents of the NWT who've shown their support for our frontline health and social service providers, and to thank our dedicated staff. Our staff and physicians, I am very aware that you are tired from the demands of the pandemic response, and I am extremely thankful for all that you have done for NWT residents and communities. Please know that you have my full support and gratitude. I will now pass the floor to our CPHO, Dr. Kandola, for her remarks.
Thank you, Kim. Good morning, everyone. Community transmission is ongoing in Yellowknife, and we are experiencing an outbreak in our underhoused and vulnerable populations. Since mid-August, there have been 19 people who use shelters who have experienced COVID-19. We've had 10 healthcare workers and support staff who provide services to the underhoused population who have also acquired COVID-19. The current community transmission in Yellowknife continues at this rate. There will be severe COVID health outcomes and societal disruption, including significant strain on the healthcare system. In order to address this situation in Yellowknife, I am issuing a 14-day temporary public health gathering order that will go into effect this evening at 5 p.m. This order is for the communities of Behchoko, Dettah, N.W.T, and Yellowknife, and will require the following: reintroduction of gathering limitations, 25 people indoors and 50 people outdoors. limitation of households to 5 persons from outside of the household to a maximum of 10 people in their home. Restriction of high-risk indoor activities unless they receive an approval or exemption from the Chief Public Health Officer. Examples of these high-risk activities include team and contact sports, group fitness classes, indoor dancing and singing, traditional hand games. Restriction of indoor extracurricular activities with the exception of school aftercare programs for children under the age of 12. Organizations, businesses, or events with previously approved exemptions under Phase 2 can revert back to those previously approved plans unless they're part of the high-risk category of activities. A week ago, I committed to reviewing the Emerging Wisely plans in 2 weeks after the outbreak has subsided in our regions, and I remain committed to this action, just as I remain committed to using every tool at my disposal to keep Northerners, especially those under the age of 12, who are currently not eligible for a vaccination, as safe as possible from the threat of COVID-19. Masking is mandatory in all indoor public spaces, which also includes all publicly accessible parts of your workplace. This includes any space that the public can access without a key or a fob. Anyone showing signs or symptoms of COVID-19 should isolate and contact a local healthcare provider. And these can be very minor, mild symptoms like a runny nose, sore throat, generally feeling unwell. If you are sick, stay home. If your children are sick, keep them home from school. I recommend that employees wear a mask within their offices when accessing common areas like break rooms, bathrooms, and hallways. This is just one recommendation to keep yourself and your colleagues safe. Additional recommendations include meeting virtually where possible, especially if you are having a meeting with people outside of your regular office bubble. Washing your hands frequently. And in Behchoko, Dettah, and Dettah and Yellowknife, work from home if it is possible to lower the number of contacts in the workplaces. If you are over the age of 12, I encourage you to get vaccinated. It is a safe and easily accessible option to prevent severe outcomes from COVID-19. The public health interventions, along with a lot of hard work by frontline workers in Fort Good Hope, Colville Lake, and Norman Wells, have contained the outbreak in the Sartoo region. The sacrifices of our fellow Northerners in the Sartoo region give me hope that if Behchoko, Dettah, and Dettah and Yellowknife residents are willing to make the same sacrifices, we will see similar results here. Individually, we must all do what we can over the next week and beyond to stop the potential spread of COVID further into our communities. Avoid non-essential travel in and out of Yellowknife and the 3 surrounding communities impacted by the public health order. Stay home if you are sick. Keep your child home from school or daycare if they are sick. Wear a mask in all public indoor locations. Work from home if it is a viable option. Wash your hands frequently. Get vaccinated if you're over the age of 12. Self-isolate responsibly. And follow the direction of your healthcare provider. All of these individual actions will collectively help ensure that our healthcare systems can continue to operate in an efficient manner, providing services and care to our neighbors, friends, and family. Thank you.
Thank you, Dr. Kandola. I think now what we'll do, we'll go through the list of media members and give you one question plus one follow-up question. Again, just a reminder to please say the name of the person whom you wish to direct your question to. Otherwise, we will do our best to direct it to the correct person. I'm going to begin with Sarah Minogue from CBC. Sarah, are you there? Okay, I don't hear Sarah, so I'm going to move on to Francis from CKLB. Francis, do you have a question this morning?
I am muted right now.
I can
Hello?
hear you, Francis.
Okay. Good morning, everyone. Sorry about that. Yes, I guess first question for probably Miss Riles regarding capacity. I believe you said that going into stage 2 of NTHSSA's kind of capacity plan, for lack of a better term. I guess I'm just curious, going beyond that, you know, if there is still a need for additional ICU beds, is that feasible, or is there going to be a point where it comes, you know, if things do get worse and more hospitalizations occur, where we are going to be sending residents down to Alberta? Yeah.
Thank you. Certainly there are provisions to further increase capacity contained within our pandemic plan. The factors we're looking at obviously are demand, so what our current demand is, and also our operational capacity, because the plan as it's set out would require additional staffing, which is always going to be our limiting factor. As we've already discussed publicly, we've engaged external resources from the Canadian Red Cross to help us to sustain increased operations and to be able to address the demand that we're seeing. In terms of our referral to Alberta, typically we refer patients to Alberta who are outside of our scope of services versus outside of our volume. So for the most part, our plan will address the ability to increase volume and use Alberta as our referral source for patients who require care that is outside of the scope that we provide.
Thank you, Kim. Francis, do you have a follow-up question?
I do. This one will be for Dr. Kandola. I guess kind of along the same lines of trying to reduce or maintain, reduce the strain on the healthcare system. We've heard from Dettah National Chief Norman Yakalaya calling on community members that can to go out on the land. Seems to be at least we've heard some confusion around what that entails. So I'm wondering, Dr. Kandola, you know, if community members are looking to go out on the land to hunt and be away from the communities, is that a viable way to reduce the strain on the healthcare system? And, you know, what are some lacking words here, I guess, advice that you would give to community members who are looking to go out on the land at this time?
So when we were working with the outbreaks in Cova Lake, Crooked Hope, we were working with the Satu Secretariat on people, low-risk people who are medically triaged, who are vaccinated or who have been tested, and to be able to be out on the land just to limit their number of exposures in terms of being in a highly dense community. But this is a collaboration between Indigenous groups and public health professionals, so that if people who are not at risk, not being exposed, but want to limit their contact if there's an outbreak going on, going out on the land, if it's feasible, is a good way of waiting out the isolation period. The big concern is if there are high-risk people who have been exposed to COVID, and if they're out on the land and they need medical attention, it's that much more difficult to reach them. But for people who are low risk, not exposed, want to limit their contacts, are in an outbreak community, there is a proper way, there's a safer way to go out on the land, and we are working with Indigenous communities who are looking at that option, just to provide the context of having appropriate medical triage, testing if possible, and ensuring that people are vaccinated. So that is just a much more culturally acceptable option of reducing their risk.
Thank you, Dr. Kandola. Next, I'm going to go to Blair McBride from NNSL. Blair, are you there? Do you have a question?
Yes, can you hear me?
I can, yeah, go ahead.
Okay, good. Yes, so my question is for Minister Green or Ms. Riles. So how many COVID patients in the current outbreak have been sent to Alberta for care?
Kim, would you like to answer that one?
To my knowledge, in the current outbreak, there have been none sent to Alberta.
Okay, Blair, do you have a follow-up question?
Yes. So you've mentioned a lot about how the healthcare system here is under strain in the current outbreak, and that Alberta also is experiencing a large increase in COVID cases. So what is the plan if Alberta Health Services say that they can't accept any more out of province COVID patients?
Kim, would you go ahead, Kim?
Okay. So Alberta treats NWT residents as equivalent to Alberta residents. So there is no intention to shut the door to NWT residents being able to access care in Alberta if it is care that is available and accessible to Alberta residents. So whether the Alberta system were to become overwhelmed and need to be on diversion is kind of a related but separate topic. So if they were to get into a position of diversion, they would continue to treat our patients as equivalent to their own residents.
Thank you, Kim. I am going to pose a question that was posed in the chat from Sarah Minogue from CBC, and that is, and I suppose this will be directed to Dr. Kandola. Can you clarify whether schools will remain open and what the rationale is, Dr. Kandola?
So schools will remain open. We've had several introductions of COVID in schools, and we've been able to isolate the specified class. What we're seeing with the school measures, we have mandatory masking, we have classroom bubbles, especially in the elementary school. In the middle to high school, we have a significant high vaccination rate. Schools can continue. Where we're seeing the exposures and transmissions is outside of the school settings. So we're going to continue monitoring the activity in Yellowknife in terms of community transmission. But with the measures in school, it would be introductions, not actual transmission happening in schools at this point. So one way to, again, increase the risk of introduction is we are, in the 14 days that we have this temporary gathering order, are restricting activities involving under 12s to outdoors. So any indoor extracurricular activities, with the exception of after school programs, we're putting that on hold. The reason why we're putting that on hold is just to avoid mixing of different schools together. So if a child does have COVID, that it doesn't then get disseminated to multiple schools at the same time. Our current approach of asking parents to keep the kids home if they're sick, ensuring that kids have masking in classrooms, limiting high-risk activities is what we will be doing the next 14 days. We are encouraging anyone who's 12 and older to get vaccinated, because that would further reduce the risk in the middle and high schools.
Thank you, Dr. Kandola. And the follow-up from Sarah is, how many people are currently isolating in Yellowknife, Behchoko, Dilo, and Dettah?
So specifically, we have 64 active cases in Yellowknife, and it hasn't been broken down to Ndila and Dettah. In Behchoko, from the public health advisory we did yesterday, we had no active cases, but we are going to be providing an update at the end of today. These are actual cases. Non-fully vaccinated contacts of these cases would be required to isolate, especially if they're household contacts. And people who are fully vaccinated, we're asking them to self-monitor.
Thank you, Dr. Kandola. Next, I'm going to call on Mario from CBC. Mario, do you have a question?
Yes, I do. I'm just kind of wondering, based on well what you said today, and also the press release from yesterday night about the people isolating from the shelters. Where I think there's some lines about alternative isolation facilities. Where can you provide more details on this? Where are these people isolating? What work had to be done to find these isolation alternatives?
Thank you, Mario. Kim, is that question something that you can provide an answer to?
Yes, I can. So NTHSSA has been working collaboratively with the COVID Secretariat. As everyone knows, the COVID Secretariat operates the isolation centers. So we've been utilizing that existing program and augmenting the supports available in the isolation center to be able to provide additional supports for the underhoused population who are isolating in those facilities.
Thank you. Mario, do you have a second question, a follow-up?
Yeah, maybe I'm missing something, but what isolation isolation centers do we still have? I do remember, of course, Arnica and Spruce Brow became something, and there was another one that I don't think is an isolation center anymore. So could you maybe refresh us on what isolation centers do we have in Yellowknife?
Sure. Dr. Kandola, perhaps you can provide an answer to that?
Yes, so just to clarify, Mario, when we talk about a list of isolation centers, these are the traditional isolation centers we've been using all along for our travel restrictions and self-isolation orders. So it would be things like Shadow Nova, Explorer, Quality Inn. The Arnica was specifically isolation center we were using targeting the underhoused population in N.W.T, but it is now used for alternate purposes, but it's still under an isolation center. So we have listed not only for Yellowknife, but for a number of the other communities, places where we can safely isolate COVID cases or people who are medically advised to isolate, or people coming in due to the travel restriction self-isolation order requiring to isolate because of essential travel in a regional hub. So those that traditionally have been the hotels, but if there is a surge and we have overwhelming need for more capacity, we have also included the arenas in the regional hubs such as Inuvik, Fort Smith, Hay River, Yellowknife. So we have included the multiplex, the Shorty Brown Arena, the Field House has larger isolation centers.
Thank you, Dr. Kandola. Next, I'm going to go to Andrew Pacey. Andrew, are you there? Nope. Okay. Next, then April Hudson. April, are you there and do you have a question?
Hi. Yes. Can you hear me?
I can. Yeah, go ahead.
Perfect. Okay. I think this question would be for Dr. Kandola. We've heard numerous reports that there was a COVID-related death on Tuesday. Has there been another COVID death?
So we don't specifically talk about individual deaths. When we do not announce a death specific to COVID, we'd be waiting for details such as death certificates and official diagnosis by the responsible parties. And once we receive that, we would definitely announce it in a public health advisory. But officially to date, we've had one death, which we've announced last week, I believe.
Thank you. April, do you have a follow-up question?
Yes. I think this one, I'm not sure exactly who this would be to, but it's regarding the COVID-19 cases among people who are experiencing homelessness. We heard today that those cases have kind of been building since, I think it was mid-August, was said. Can you tell me why it took so long to disclose that, and like why you didn't, announce that earlier?
Minister Green, perhaps you can take that question.
Yeah, the cases are reported as a group in Yellowknife rather than isolating particular populations by their housing status or whatever. And so I think that and Dr. Kandola can certainly speak to this, that we've reached a point of community transmission in the homeless population that was starting to strain the system, as you heard earlier. And that's the reason that that population has been identified as a group who are in particular need of isolation and services. I'd like Dr. Kandola, who does the reporting, to talk about why she chose to identify that group particularly. Thank you.
So with the Delta variant, it has a high transmissibility rate, and specifically in under-vaccinated populations, it can move pretty quickly. I know in Yellowknife overall, we have a very good vaccine uptake, 83% for adults first dose and 80% of adults are fully immunized. So what we know specifically in the underhoused population is that we initially had one case about 2 weeks ago, and the appropriate response was given. We had the case isolated, we had the contacts isolated. We finished that contact period last week, and then late last week, we had an additional 4 cases become positive. And so again, those cases were appropriately isolated, contacts were identified. Over the weekend, we had a rapid increase of more positive cases in the underhoused population. And also, in addition to that, support staff or healthcare workers working around that population were also coming down with COVID. It was because of what happened, because of the exponential increase over the weekend. Also, we started to see more hospitalizations at Stanton, more ICU admissions. This is what led to the public health advisory on Tuesday, where we were able to pull all the data, both in the actual underhoused population, but the support staff, and provide public health advisory. It also led to the decisive action that we need to put in a gathering order, because the amount of people we've identified in the underhoused community is 19, plus 10 additional staff. But this is the tip of the iceberg. When you look at exposures, there are many more people who are exposed. And in the next 14 days, we anticipate that those people who are exposed to COVID will become symptomatic and require support so they can isolate safely. And a few of them, unfortunately, will end up needing more medical attention at the hospital.
Thank you, Dr. Kandola and Minister Green. Next, I am going to ask Emily Blake from Cabin Radio. Emily, are you there? And do you have a question?
Hi, yes, I'm here. Thank you. I'm not sure who this question should be directed towards, but about a week and a half ago, some concerns were raised about how the isolation center at Quality Inn was being managed and that it was putting people at risk for COVID. Were those concerns taken seriously, and what steps have health officials taken to improve the safety and the management of that isolation center?
I believe you're asking about enforcement. So for that, I'm going to turn it over to Premier Cochrane to answer your question.
Thank you. So at all isolation centers, we do have staff that help to inform the public on what is expected from them and help them with services. With the amount of people in the isolation in Yellowknife, we've actually increased our security at this moment. So we're providing additional support through the enforcement, just so that people make sure that they understand the rules as we go forward. As well, we're working closely with health and social services, who are providing, like was said earlier, additional support for the population that is highly vulnerable. So we provide the additional security as needed, and as we go forward, if we need more, we will provide more. Thank you.
And
thank you, Premier.
As you know,
Emily,
sorry.
No, go ahead.
Yeah, so as we know, capacity is still restricted at shelters in the territory, and there aren't enough shelter spaces in Yellowknife, and the government has been looking for additional space for some time. Given the outbreak among this population, will that be expedited, or will there be an interim solution found?
That question, we'll direct that to Minister Green.
Yeah, thank you. As you may be aware, the department advertised for a request for information asking people who may have space downtown to come forward and identify themselves so that we could look at the possibilities. We had 3 responses. We are looking at one of the possibilities in particular, and we do realize the urgency for getting this shelter, this day shelter up and running. As already stated, people who need to isolate because they are a contact of a case or they have COVID themselves, those needs are being taken care of right now. The day shelter is open, and people who can't get into the shelter can access food outside of the shelter. So there are shelter services, but they are thin, and we are planning to bring another shelter online within the next month to 6 weeks. Thank you.
Thank you, Minister Green. Next, I'm going to go to Thomas from Media Tenwans.
Yes, hello. I think this question would be for Dr. Kandola. Do you know what is the factor behind the recent surge of hospitalizations, since 30% of all hospitalizations have happened during last weekend?
The factor is a dramatic increase in COVID-19 infections occurring in multiple communities. And unfortunately, when we're looking at hospitalization ICU admissions, the bulk of them are in the non-fully vaccinated individuals. So this is an urge plea for those who have not yet gotten vaccinated. Please get vaccinated, because we do see that difference in severe outcomes in the non-fully vaccinated. And when more and more people get exposed to COVID, there'll be that much more increase in risk of some people not recovering within 10 days, but going on to requiring hospitalization, ICU admissions.
Thank you, Dr. Kandola. Tomas, do you have another question?
Yes, thank you. I think this one would be addressed to Minister Green. Concerning the recent underhoused and vulnerable population outbreak, what kind of support is available for people who may be experiencing withdrawal symptoms while being in isolation?
Thank you for that. That is the kind of operational detail that I think that Kim can provide. Thank you.
Thank you. Part of the services that we're providing to those additional supports that I referenced for the underhoused population who are being accommodated in the isolation centers are to encourage people to maintain isolation. And so that includes managed access to substance and oversight of that. So that would include alcohol and cigarettes, and that is provided by our team who are on site and actually helping to support that population.
Thank you, Kim. With that, I think we will close the question period there. I don't have any more folks on my list, and I do not have time to run through the list and give everybody another chance entirely. So we'll conclude the briefing there. I would like to thank Premier Cochrane, Minister Green, CEO Riles, and Dr. Kandola for your comments, and thank you to all the media for joining us today. If you have further requests, please feel free to reach out directly to the press secretary or to the COVID Secretariat communications team there with further questions. And thank you very much. Enjoy the rest of your day.